Hi everybody, today we will be discussing anxiety disorders and the disorders that fall under this broad category. My name is Megan and I will be starting off by discussing the background and significance of anxiety disorders. Followed by this intro, Jennifer, Ryan, Matt, and Adelaway will present their parts of the presentation. To begin, I will give you an overview of what we will be talking about today, starting with the introduction. What is an anxiety disorder? So I will give you a definition and what it is really. Next, I will talk about the background and why it is significant. What is important about anxiety disorders and what do we need to know about it? Following that, we will talk about characteristics and symptoms and what happens when you have this disorder. After that, we will talk about the causes, the known and hypothesized causes. Following that, we will talk about treatment or intervention. So what treatments would you use to treat this disorder and the background to support it? And how is this disorder portrayed with the media and the stigmas around it? So according to the DSM-5, anxiety disorders are defined by a number of points. Starting with a fear that does not go away. So this is regarding social or performance situations when someone is exposed to people that they don't know or someone they're not comfortable around. When they have this anxiety disorder, a person can feel like they will act in a way that will embarrass or humiliate them. The second point is that when they are exposed to the situation, they are afraid of it immediately provokes anxiety, which may take the form of a predisposed panic attack. The next point is that the person recognizes that this fear is unreasonable or excessive, but they can't do anything about it, despite the knowledge of how unreasonable they really think that it really is. Furthermore, the feared situations are avoided at any extent, and if they can't be, the person becomes overwhelmed with intense anxiety and distress. The avoidance, anticipation, or distress that the person has interferes significantly with the person's normal daily routines, like school or work, their social activities or relationships, or there is marked distress about having the phobia. The next point currently reads in the DSM-5, the fear, anxiety, or avoidance is persistent, typically lasting 6 or more months. This has been slightly altered from the DSM-4 that used to read, the duration is at least 6 months. The wording has been changed slightly, but overall means the same thing, and that the symptoms of the disorder last for at least 6 months. And finally, with someone who has an anxiety disorder, the fear or avoidance they experience every day is not from direct physiological effects of a substance like drugs or medications, and it is also not due to a general medical condition that is not better accounted for by another mental disorder. To further the definition of anxiety disorders, I would like to talk about anxiety versus fear and how they are different. Both of these terms are used when talking about anxiety disorders, and people tend to get them confused with one another. With that being said, an anxiety is a future-orientated mood state associated with preparation for possible upcoming negative events. And fear is defined as an alarm response to present or imminent danger, real or perceived. The important thing to note here is the perceived danger. This is just as important as real danger, as the person experiencing this fear truly believes that they are an immediate threat or danger and are truly scared, regardless of if it is real or not. So to continue with the background information of anxiety disorders, there are many disorders that fall under this category, including generalized anxiety disorder, commonly called GAD, separation anxiety disorders, selective mutism, specific phobia, social anxiety disorder, panic attack, and agoraphobia, which is actually the fear of crowded spaces or public places. The one that we will be focusing on is generalized anxiety disorder, GAD, and it is a psychological disorder characterized by excessive or disproportionate anxiety about several aspects of life, such as work, social relationships, or financial matters. So some facts about GAD is that generalized anxiety disorders not only affect adults, but children as well. Although it is harder to diagnose in children of a younger age, it is still important to understand how common anxiety disorders are. In 2015, we saw that over 40 million American adults suffered from anxiety disorders, and only about 1/3 of those 40 million received treatment, even though this disorder is highly treatable. We do not know if it's because they did not seek treatment, if they weren't aware that they could receive treatment, but for some reason only 1/3 did receive treatment. The last thing I'm going to talk about is why are anxiety disorders significant. Anxiety disorders in themselves are significant because of how many different categories there are within the broad name it has been given. One person's experience with an anxiety disorder may be very different than the next, and it is important to understand why. I think it is very important that we as a society understand what it means to have an anxiety disorder and how you can help someone who is suffering from one. The way that we can do that is to raise awareness and try to get people to understand the severity of it. Anxiety disorders can lead to or sprout from other disorders such as depression, PTSD, OCD, and if it is caught early, we can help treat those people who suffer from any of these disorders and prevent them from progressing to a new stage of their current disorder or a new disorder altogether. At this point, Jennifer will continue with characteristics and symptoms of anxiety disorders and what we should look for when diagnosing an anxiety disorder.
I will be explaining about the characteristics and symptoms of anxiety disorder. Everyone experiences some sort of anxiety in their lives, but they are short-lived. For example, even right now, as I'm explaining my part, I'm a little tense, but I still have control over my fear. So how do you know if you have an anxiety disorder? If one experiences cognitive, physical, and behavioral symptoms of anxiety, which are both persistent and excessive to the point where it negatively impacts one's life, then they have an anxiety disorder. Anxiety disorders have many symptoms and can be characterized into different groups. For example, those with OCD or obsessive-compulsive disorder may have different symptoms in comparison to those with social anxiety disorders. There are many different anxiety disorders, but they all share similar symptoms such as excessive fear or worrying, tense feelings, difficulty managing everyday life tasks. In the next two slides, I will be more specific and talk about the symptoms and characteristics of generalized anxiety disorder, also known as GAD, and social anxiety disorder. Characteristics and symptoms of GAD. An individual with generalized anxiety disorder is characterized as having excessive and persistent worrisome in every situation. Individuals with GAD usually expect the worst in a situation where there's no need to be concerned for. For example, a person with GAD may not be able to sleep during the night because they fear that the ceiling will collapse on them. Usually, the anxiety is caused by overanalyzing situations about money, health, family, work, and other issues. A person with GAD will find it difficult to control worrying about situations because the anxiety levels are far more intense in the situation they are in. A person is diagnosed with GAD once the symptoms are apparent for at least 6 months and 3 or more symptoms are combined together. Symptoms listed in the DSM for generalized anxiety disorder include 1. Restlessness, 2. Being easily fatigued, 3. Difficulty concentrating, so worrying about little things to the point where they can't focus on what's more important, 4. Irritability, they can't solve their own problem and due to high stress levels can be irritable with others, 5. Muscle tension, the more they worry, the more tense their muscles become, 6. Sleep disturbance, so they worry to the point where they cannot sleep and lack of sleep can cause them to not function well in school or work settings. People with GAD can function well socially and can function in everyday life, such as school or job settings, if their anxiety level is mild. However, if anxiety levels are severe, some people may avoid everyday life situations. Characteristics and symptoms of social anxiety disorder. Social anxiety disorder is characterized as the extreme fear of being judged by others in a social setting. Those with social anxiety disorder can have disrupted lifestyle because of their symptoms. A common misconception is that the disorder is simply just shyness, but it's really not. Individuals with social anxiety disorders can isolate themselves with those around them, leading to few or no social or romantic relationship with others. This leads them to feel powerless, alone, and ashamed. The typical age for the onset of social anxiety disorder is 13 years, and about 36% of those with social anxiety disorder report that they seek help after experiencing the symptoms for 10 years or more. DSM-5 states that in order for an individual to be diagnosed with social anxiety disorder, their symptoms must be persistent for at least 6 months. Physical symptoms of social anxiety disorder include blushing, sweating, sweaty palms when you're talking to others, heart palpitations, abdominal distress from being anxious or meeting others, and headaches. Social anxiety disorder is more than just being shy or afraid of talking with others or presenting in front of a large group of people. People with social anxiety disorder feel powerless over their anxiety. They're afraid of embarrassing themselves in front of others and are afraid of people judging them for what they do or say.
Okay, so next I'm going to go into what causes anxiety disorders. First of all, there are several different kinds of anxiety disorders out there, such as panic disorders, social anxiety disorder, specific phobias, and generalized anxiety disorder. But what really causes these disorders anyway? Well, experts currently do not know what the exact cause of anxiety is, but they do believe it could be due to any of the following or any combination of the following risk factors, such as stress, genetics, a traumatic or significant event in our life, or substance use and abuse. First of all, I'm going to go into how stress can cause anxiety disorders. So there are many different forms of stress out there, such as stress from work or school, financial stress, stress from relationships like from marriage or family, and stress from certain medical conditions like from a past surgery. Studies have shown that there could be a link between anxiety and the regulation of fears and emotions in the functioning of the brain. Stress can cause a change in the way the nerve cells within certain circuits transmit information throughout different regions of the brain. Excessive stress can also cause headaches, muscle tension, and a fast heartbeat or rapid breathing, which are all risk factors for anxiety. Next, I'm going to go into how genetics plays a role in anxiety disorder. So studies are now being done that have shown that anxiety disorders can run in families, as the mental illness can be inherited by parents or other family members. There is a strong link between our DNA code and the occurrence of anxiety disorders. Approximately 30 to 40% of the variability of anxiety disorders is associated with genetics. When anxiety disorders develop before the age of 20 in individuals, then relatives are more likely to have the mental illness as well. Studies have also shown that an individual has an even greater risk for being diagnosed with panic disorder if a twin has it or if a direct relative has it as well. Next, I'm going to talk about how a traumatic event or significant event in our life can cause anxiety disorders. So this is the leading risk factor for developing an anxiety disorder. Anxiety disorders can cause a change in brain structures that control memories associated with strong emotions. These serious traumatic events like abuse, serious accidents, and difficult family relationships can all result in anxiety disorder symptoms. These experiences that we have in our life can get implanted in our memories, causing serious mental health problems. Finally, I'm going to talk about how substance use and abuse can cause anxiety disorders. So approximately half of the people who use mental health services because of anxiety disorders are those who consume large amounts of alcohol. It can also be triggered by other drugs such as cocaine, heroin, or prescription drugs. Usually those suffering from anxiety disorders tend to turn to drugs thinking it will make them better, when really it is just making the disorder worse.
I'm Matt, and I'm going to be talking briefly about anxiety disorders and the treatment for anxiety disorders. Here's just a list of anxiety disorders as they're listed in the DSM-5. I'm going to be focusing, as far as treatment is concerned, I'm going to be focusing more on the generalized anxiety disorders. There's a pretty long list of disorders here. So for pharmacological treatment of generalized anxiety disorders, so that's treatment with medication, the goals of therapy are to produce a clinically meaningful improvement in symptoms. And there's two scales that they use to rate if there is an improvement in symptoms and reduction of anxiety. That's the Hamilton Anxiety Scale and the Clinical Global Impression Scale. The Hamilton Scale is there's a list of 14 questions that are asked by a mental health professional. Examples would be asking people about, or patients about, their anxious moods, tensions, fears, insomnia, depressed moods. And they rate those from not present to mild, moderate, severe, very severe. So a 50% decrease would be considered significant using that scale when after treatment. And the CGI scale, the Clinical Global Impression Scale, is a scale from 1 to 16, and it measures the direct effect of a drug and its versus its side effects, and if it's worthwhile to take. So 1 would be the best; you would have a vast improvement in symptoms, and 16 would be the worst. Theirs would be unchanged or worse symptoms, and the side effects would be the worst. So there's two medications that are generally used for the long-term treatment, and that's SSRIs and SNRIs. SSRIs are selective serotonin reuptake inhibitors, and examples of that would be Paxil, Prozac, Celexa. SNRIs are serotonin norepinephrine uptake inhibitors. Example would be Effexor. They're used for long-term, and benzodiazepines are used generally for acute treatment of anxiety symptoms. They're usually only used for about 2 to 4 weeks because of people tend to get dependent to the benzodiazepines. So they use those for 2 to 4 weeks while the SSRIs or SNRIs are becoming effective. They take that same amount of time to become effective once you start taking them. And then a couple of other medications are anticonvulsants and antipsychotics, which are sometimes just used to augment those other frontline medications. And both SSRIs and SNRIs have shown pretty even results. They're both very effective in treating anxiety. And like I said, the benzodiazepines are very effective, but they do have a risk of dependence over long-term use or with higher doses. So they're generally only used for the acute treatment to get anxiety symptoms under control. And then, the other side of treatment would be the psychological treatment. So you have the two main schools of thought would be cognitive behavioral therapy and acceptance and commitment therapy, and they can be used in conjunction with the pharmacological treatments. So a lot of people would be doing both, the psychological and pharmacological treatments. So the cognitive behavioral therapy is that's kind of the go-to, the frontline treatment for anxiety, and it's a talk therapy, and it's very problem focused, and it focuses on changing negative thinking in the hopes that will then in the future change any negative behaviors or anxious thoughts and anxious behaviors in the future, and that's done with a mental health professional as well. The other therapy would be ACT therapy. That's acceptance and commitment therapy, and it's sort of similar, but it focuses more on acceptance and mindfulness strategies, and it's a little bit more flexible. It's not necessarily focused on elimination of the difficult feelings and emotions, but it teaches to accept your emotions more, be mindful, and get to know your unwanted feelings and learn how to act out on them in a more positive way. So this study here is it's actually a literature review that was done that reviewed the different types of pharmacological treatments and their effectiveness. So it's found that SSRIs, like I said earlier, usually take 2 to 4 weeks to become effective. But once they are effective, the long-term remission rates are around 73%, with about 11% of people relapsing back into anxious feelings afterwards. So that's a very significant effect for SSRIs, and SNRIs are along the same lines as that, around 70 to 75% effective rate. And the benzodiazepines are very effective, but like I said, they're only used for 2 to 4 weeks to reduce the impacts of dependence. And tricyclic antidepressants, during the review, they did briefly say that those used to be the frontline medication that was used, but they have a very significant dangerous overdose effect. So most mental health professionals are steering away from tricyclic antidepressants and going towards other less dangerous drugs.
Over the past decades, a substantial amount of research has been conducted to determine the effect of the mass media on mental illness. A considerable number of this research have shown that mass media are the major channel of information about mental illness to the general public, and it has also been concluded that most mass media representation of mental illness promotes negative images and stereotypes. In particular, the false connection between mental illness and violence. Many other studies have also found a connection between negative media portrayal of mental illness and the public negative attitude towards people with mental health issues. Here are some of the negative portrayal of individual with mental illness, that is the way people see them in the society. One, people see them as rebellious set of individual, violent, unsafe, dangerous, unpredictable. Even on the television, or people portray them as an outcast, people without house, without home, without family, even without friends, unemployed, unproductive set of people. People also see them as antisocial. They see them as failure, even as nuisance in the society. Due to these negative images and stereotypes, it has also been reported that people with mental illness regularly suffer discrimination because those negative images have caused people in the community to have every reason to fear them. Apart from that, here are some of examples of positive media portrayal. A good example can be seen in a movie called Mark, in which a private detective named Andrew Mark battled with severe anxiety and obsessive compulsive disorder since the murder of his wife. He was relieved of his position due to his mental condition or state, but through the help of his friends and practical nurse, he was able to live and control his condition, and he started working as a freelance detective and was able to even solve several cases. Another example is can be seen in another movie called As Good as It Gets, in which Nicholson who was struggling with an obsessive compulsive disorder, played a romantic role. He was able to win woman of his dream and live and control his condition. According to one of the survey conducted among people with mental illness, it has been reported that about 34% of them said that negative images is one of the factors that increases their level of depression and anxiety. About 22% said that it caused them to withdraw and isolate themselves from the society. About 8% said that it makes them think of committing suicide, while about 25% said that it makes the people in the community look be hostile towards them, rather. Here are some of the influence on the stigma. Number one, it can cause, it can cause, it can impede recovery from the condition. That is, it impedes people from recovery. Two, it triggers discrimination. Three, it can create barrier to seeking and finding decent house, employment, and even education. It gives them so low self-esteem because it damages their confidence, and it creates barrier to seeking treatment. It can also cause health practitioner to treat mentally ill individual with same attitude like the general public.